Hi, and welcome back to Ask a Midwife Anything. This is the first official video with some educational information. And what I'd like to start with today is all about dating a pregnancy and dating ultrasounds to determine due dates. The most common thing that we use to determine a patient's due date and how far along they are is using the first day of their last menstrual period. This is very accurate and what most people end up using to determine when their due date is going to be. Now, there are people that fall outside of those bounds. So people who have really long cycles and typically tend to ovulate later, the first day of their last menstrual period is not going to line up with actually how far along they are. If people have really irregular periods, they're not getting a period every month. Sometimes people come in and they only get a period every 3 months. And so that can cause there to be a discrepancy in the due date and actually how far along someone is if we use the first day of the last menstrual period. And then there are people who just have no idea when the first day of their last period was and weren't tracking or monitoring it. So what we will do in everybody's case is get a dating ultrasound to confirm a due date. And ideally, the best time to do this is when someone's about 7 weeks along. This gives us a little bit of wiggle room if we're not quite exactly as far along as we think they are. So if the patient's a little bit farther along than their last menstrual period would suggest, then we still catch them in that nice window where we can still order everything. They're not going to miss anything, especially with regards to genetic screening. And so if they're a little bit further along, it doesn't create a big issue. On the other side, if they're not quite as far along as we think they are, and maybe they're only in their 6th week, it also works out well because typically you will see fetal cardiac activity. So you'll see the heart beating on ultrasound in that 6 weeks. So if we're a little bit earlier than 7 weeks and in that 6 week, we usually still will be able to see what we need to see and lets us know that it's a viable pregnancy. Where it gets a little bit uneasy for some people is if we're doing ultrasounds much earlier than 6 weeks. So if someone's actually 4 or 5 weeks pregnant, we're really not seeing what we need to see. We're not seeing that heart beating in order to confirm that it's a viable pregnancy. And this can be really difficult for people, especially if they think they're farther along and measurements are showing that they're earlier. This usually requires that we do some blood work and we follow up on some things, which we will talk about in another